Welcome to the fifth episode of CCBH Chats. Our discussion today is New Year, New Me. We're pleased to have with us today Dr. Michelle Folsom Elder. Dr. Elder is actually an employee of the Calvert County Health Department, and her title is the Physician Liaison. And I am Anita Ray, and I am the Grants Manager for our non-crisis programs with Calvert County Behavioral Health. We're going to start our discussion today about the new year and looking forward to things that are more positive. So one of the first questions that I have for you, Dr. Folsom, is when thinking about approaching the new year, what are some of the things that kind of remind us regarding wellness?
Mm-hmm. So I like to think that every small bit of change can improve us, not only individually, but as a group, a community, an organization. So I like to take a look at small things that might be able to impact us. What can make us have more joy? What can make us feel more fulfilled? What can make us healthier? Mm-hmm. That can be physical health. It can be mental or spiritual health, emotional health. I truly think that if you choose some things that really speak to you personally, that are small and individual, that can have a ripple effect. If you perhaps choose to do some more reading that is geared towards maybe some self-improvement, that might trickle down, and maybe your parenting skills are going to improve, or your communication with people at work might improve. And then those things can kind of filter out from there. Yeah. So I really like to think about the small changes that can be made that will impact people at the beginning of the year, and then growing upon that throughout the year, expanding upon that throughout the year.
Yeah. Well, you mentioned some things about whether you can grow physically, you can grow emotionally, you can grow spiritually. Can you share some things that you think may be helpful in those three categories, as far as let's say I want to grow physically, emotionally, and spiritually during this new year. What are some of the suggestions that you would have for our listening audience?
Sure. I think for me personally, and what I typically recommended professionally, was to start with some specific things in mind that you knew that you could work towards. Walking, is certainly a wonderful way to improve not only your physical health, but when you walk, you may take the time to think about things that you have to get done, or you may use that time to do some prayer or some work on your mental health while you're out walking, re-engaging or engaging with family members and friends. And I know this past couple of years have been very difficult for families, not only because of COVID, in terms of the actual health consequences, but because there have been disagreements and things like this. So it would be important for some people in our community to really try to, mesh a little bit more with their family and friends that they may have lost touch with. And that may provide some mental health benefits. Certainly things like spending time with family, our individual nuclear families has been easy. That's been sort of an easier task for some of us. We've been sort of forced into doing that, but it's been a blessing. And so taking the lessons that we've learned from being with our nuclear family and using those lessons outside of the home is definitely something that I would look to. And many of us who attended church regularly before the pandemic, myself included, have felt, a little bit of disengagement from that perspective. Watching mass on a TV or a computer is not as emotionally connective and doesn't really help as much that way. So engaging in regular activities for prayer and for volunteerism, which I think taps into a lot of spiritual and mental well-being. Those would be things that I would recommend, certainly.
Yeah. I do think it's really important that we reconnect with grounding ourselves again. And it's unfortunate. This last 2 years has been very, very trying in a lot of different areas.
Yes.
And so I think we do have some local resources that we have in this neck of the woods that we would like to share with people. So can you talk a little bit about some of the things that are available to people in the community to help with that growth, whether it's spiritual, whether it's emotional, whether it's physical?
Sure.
Where can they go? Where could they look to?
Right. So I always tell people, certainly when you're talking about your well-being, having an active, engaged medical provider is really important. One of the things that we learned throughout the pandemic is that a lot of people, go without a medical home,
Yeah.
as it's called. And so it's really important for us to try to focus people on re-engaging with a medical provider who would be able to help with your physical well-being and your mental and your emotional well-being. But additionally, the health department does have opportunities for you to grow, both from a behavioral perspective, a behavioral health perspective, but also physically. We have smoking cessation,
Yeah.
which can certainly be, I think this time of year is a great time of the year to start thinking about ways that you might be able to quit smoking. We have diabetes prevention classes, which are aimed at reducing body weight and helping with overall sugar levels for our community members. And we know that that's certainly something that plays a role in your overall well-being and health. And that's a longer program, but it does prove very beneficial for the people that are engaged in that. And then ultimately looking at places outside of medical resources. So, looking at programs that might be at at your local churches or parishes. I know many people who actually volunteer for animal welfare leagues or animal rescues. They can go take a dog for a walk, and they feel great walking, and they feel like they're giving back. It's an opportunity for them to improve their overall health. One thing that I do in my spare time is I like to garden. And a long time ago, I read about or heard about guerrilla gardening, and guerrilla meaning sort of like they do in other countries with ambushes and things. So this is where you take some seeds and they're all in soil, and you throw them into places that you want them to grow. So they have like sunflower seed bombs and things like that. But if people sort of view themselves as sort of their own seed bombs, they can go into communities and make differences, improving the overall well-being of other people. So I don't want anybody to underestimate that some of the resources are right within your own neighborhoods or communities. It might be people that you regularly engage with that can help you.
Yeah. I know we were talking about the physical, emotional, spiritual, but one of the things I think has been a challenge too during this time is cognitively, people have been challenged. You know what I mean? Like, so I was thinking about, I was reading somewhere about the less we read books, the less we have creativity. So because we have so much social media that someone is always kind of controlling your thoughts, your ideas, but the more, when you read, then it kind of helps you think through how you create your own creativity. Absolutely. So I was thinking about people cognitively. How can you improve that piece for as, new year, new me? I mean, cognition, how do you address that piece of it, Dr. Folsom?
Well, I read an interesting study a while ago. I can't remember exactly where it was, but one of the pieces that I think meshes things very well in terms of technology and doing things like reading is maybe engaging in podcasts or audiobooks. I think many of us are trying to do a lot more in a given time. And this was happening even before the pandemic, but certainly now maybe our kids are home with us, or maybe we're helping take care of another family member that we weren't before. So podcasts actually engage the same portions of the brain as reading. And so if you, especially with audiobooks, the same philosophy. So you're really trying to work those same parts of your brain to sort of keep that cognition healthy. The other thing that I've started looking into is, mindfulness techniques. I know that this is a very PC sort of popular term, but there's a lot of groups out there that practice mindfulness techniques, and that might be something to kind of keep in mind when you're looking at ways to improve your overall health and well-being. I also typically recommend things like crossword puzzles, Sudoku puzzles. Those have been proven somewhat helpful to keep your cognition and your mental awareness in check and improving throughout your years. But don't underestimate physical activity too, because physical activity certainly, walking, doing yoga, doing things like that, that actually can improve your mental well-being and fitness as well.
Yeah. When you talk about mindfulness, just for our listeners out there, what are the specific things you can do that it will directly relate to what mindfulness activities can you share with us? That
Yeah.
people can
So,
do?
I mean, and obviously people can correct me if I'm wrong, or maybe they have some things to sort of feed back to us.
Okay.
But my understanding is that essentially mindfulness is a way for us to take some time and to do some feedback
Okay.
with guided imagery.
Mm-hmm.
So focusing in on things that you might not be thinking about on a regular basis. You're worried about doing X, Y, Z, and so you can do guided imagery, breathing techniques,
Mm-hmm.
and refocusing some of that energy into being more present and being more in the current status that you are, and
Yeah.
not really having to be as anxious or worried about the past or the future. A doctor told a family member yesterday not to perseverate, and so I
Yeah.
love that word, perseverate. And I think it's really important because right now a lot of us are continuously thinking about the same things over and over and over again, and it can become a bit of a tailspin. And so at some point you sort of have to stop thinking in that
Yeah.
respect and just say, where am I right now? What can I do to optimize things? Yeah, I want to do really well in the future. I want to be healthy, but what can I start with right here and now?
Yeah.
So I don't know, Anita, do you have programs for mindfulness? Because I didn't even think about that before this.
Yeah. Well, I can tell you what we have done. So far as our team is concerned, we have a staff person that has practiced like Buddhist principles. And so we've done it for our staff where we have done mindful activities where it's music, it's guided imagery, like you say,
Right.
breathing techniques,
Right.
reframing. One of the things we did talk about too is that, and I think I've shared this with staff before, is that a person that is sick has thousands of desires. Not one desire, but a person that is happy has thousands. So what happens is that the more desires you have, the more you open up suffering. But when you just have one, you focus on that one, you let everything go, and guess what? It comes to fruition. And I think that's what you're saying is that because we perseverate or we ruminate or we become anxious about things in the past or what we think will be in the future, if we're not in the, then and there, but we're in the here and the now,
Right.
it helps you far as grounding yourselves.
Yes. Yes.
And I think that those are the things I think are the most powerful when it comes to how to manage your day-to-day experiences with your life. I mean,
Right.
because unexpectancies that's a guarantee. There's nothing
Yes.
you can do about that.
Yes.
Yeah. So we do have someone on staff that did a wonderful job for us. Where we had a staff retreat several months ago. We did everything. It was actually mindfulness.
Mhm.
And there's certain videos. Chelsea and I did a training before about mindfulness, how to actually do the activities, what are the things that you can do that daily, yoga, breathing, guided imagery,
Yeah.
and really being single focused on one separate thing. And it's hard today in this world where
Yes.
you're pulled in so many directions all at the same time.
Mhm.
I got a 16-year-old kid. You know what she always tells me? Mom, there's no way in the world that you can multitask because you're never going to give one thing the full attention. And I guess there's some truth to that,
Yeah. Yeah.
And I think that we just have to slow down. Yep.
And it is hard. I think that was the pause button at the beginning of the pandemic
It
sort of,
was.
it was the sort of, okay, we need to reset. I think now it's a lot of about how to put things back together in those, the pieces that we did have before the pandemic that maybe we appreciated or enjoyed.
Yeah.
Plus some of the slowness that came with those first few months of the pandemic where things were sort of calmer and there was less go.
It was.
I mean, from a personal perspective, it's not like my kids are not yet old enough to be constantly involved in things, but I did see some recent, somebody sent me an article about, trying not to do too much for kids and not overschedule and things. But we as adults need to, kind of do the same thing. I attended a seminar back when I was in college, and it was about, making the best of your 24 hours. And we all have the same 24 hours. It's a matter of how we sort of prioritize what we want to do and the things that we want to get accomplished. And so sometimes even, not that this is a practice that's part of mindfulness, but maybe taking off from mindfulness is that whole idea of, just really trying to look at the next 24 hours and the next week, and try to be less, more intentional about that approach.
I think that's really good advice. I think, I talked a lot and kind of skirted around the whole pandemic discussion. And so I think with COVID, since it's been 2 years now since we've been in the era of COVID.
Yes.
And the virus has evolved from the first day it launched up until now, and it's continually changing. That's scary for people and a lot of uncertainty. And so could you give us some of the best preventive things that maybe we don't know as a general public? Because I'm pretty sure there's things that we don't know, or maybe we're just misinformed about the evolution of this virus that's been here for a little more than 2 years now.
Sure. And I think just to sort of start off, obviously, from my perspective, it's a little bit, skewed as I'm dealing with COVID day in and day out. And I think for a lot of people that don't deal with it day in and day out, it's a little bit, it's something that maybe is really not as important or on the radar screen. But there are things that we can do to help reduce our risk, not only to ourselves, but to our family members and to our loved ones and community members. So, the best practices still are to maintain as much social distancing as possible from other people. I'm not saying that you don't want to be around others, but, certainly we want to be cautious of that. One of the things that has come up in multiple medical groups that I'm in is just this, before the pandemic, and even now that we're getting 2 years into it, there's a lot of discussion about just stay home when you're sick. Well, before the pandemic, people never stayed home when they were sick. I would see patients in the office and they'd have a fever and they'd want to go right back to work.
Yeah.
I'd have to explain to them, look, you're contagious. You work at a bank. It's probably not a good idea to go back. That kind of thing. So one thing is to be mindful, again, of if you're feeling not well. And I know not everybody has the luxury of taking sick leave, but to the greatest extent possible, when you're feeling ill, stay home and try to get an assessment as quickly as possible. Another example of re-engaging with your medical community, your medical provider. Certainly, things like masking does reduce transmission of respiratory illnesses. And we know this kind of in general. When you go into a hospital, even before COVID, if you were taking care of a TB patient, for instance, I took care of many of them in Baltimore and Philly, and you would don your gear. And so we know that does reduce transmission of illnesses. The last thing, and probably the most important, and I know that there's been much controversy over it, but vaccinations are incredibly helpful at not only protecting against illness, but protecting from severe illness. And right now, our medical community is certainly overrun with patients that are ill. And it is taking its toll on not only the medical professionals, but people who need medical care for other non-COVID related causes. So it's very important to consider getting, if you have not received the vaccine, certainly consider getting it. And then certainly for those who've received it, a booster dose would be recommended. And I like to think of this as, if you're thinking back to your childhood immunizations, and I did family medicine before this. I practiced here in the community for about 12 years before coming to the health department. And we, when you see a baby, they get vaccines at 2, 4, 6 months of age, then 12, 15 months, and then another shot at 4 to 6 years. And that's to maintain those antibody protections into older childhood, adolescence, and into your adult years.
Yeah.
It's why we need tetanus boosters. If we cut ourselves or step on a rusty nail, if I'm out in the garden and I happen to do something with the soil, or if a farmer is hurting themselves, or if a dog bites them or something like this, we would recommend a tetanus booster. So be mindful that vaccinations do definitely improve the likelihood that you're going to get COVID, the likelihood you'll transmit, and then more importantly, that it'll protect you from severe consequences of the illness. We are very fortunate to be ready, hopefully in the next couple months, to have some more ubiquitous, sort of out there medications that could be utilized as an outpatient basis. It's been approved. It's just they're not out there in a large quantity at this point. So, but vaccines are still the best and most effective thing to do to prevent at this point.
So we could look forward to some sort of medication for.
Yeah. So much like Tamiflu, most of us are familiar with Tamiflu, which is the medicine that's prescribed early on in the flu-like illness. And that reduces the likelihood that you would be sick super long. It also decreases the likelihood that you would have complications. But similar to that, there are medicines that have been studied and approved for COVID. The problem is that it takes some time to get those manufactured. And so right now, they're not widely available to people in the community. But it's something that we do anticipate coming down the pike. And so certainly, even if somebody's been vaccinated, if they eventually come down with COVID, they do have a chance of getting that medication in the future to hopefully decrease the likelihood that anything will happen. But with Omicron, the best bet is certainly to do the vaccinations and to stay home when you're sick and just follow those good old-fashioned principles that we've been hoping that other people are following.
Well, that's encouraging. So this is my last question, and I always ask the same question to everybody that comes on CCBH Chat. If there's one thing that you would like to share with our listening audience in regard to New Year, New Me, what would you want to share with them?
I really want people to focus on making small. I really think that if people were to focus on small changes, that would accumulate over time or could piggyback on one another, I think that really is a very good strategy for improvement of your overall health and well-being. And as I said, I think this pandemic has made people more divisive, but I'm hopeful that as we sort of come out of it, there will be a lot more reconciliation and improvement of communication between people who, our growth potential is highest when we're facing a challenge. They always say that people, when they meet, if they go on dates that are more exciting or more challenging, they may have a higher likelihood of sticking together for a little while. But we grow when we're challenged. Runners can attest to this. When they go from running a 5K to a 10K, that's when they might, achieve more. They may improve their pace, those sorts of things. So challenges are helpful, not only physically, but emotionally and mentally and spiritually. So working on ways that we can improve connections with other people that might actually improve our health, and reaching out to people, people that you might not have talked to for a while, or, friends that you might not have heard from, family members that you might not have heard from. Take the opportunity to get back in touch with them and see if that can help improve some of your feelings of goodness through this year.
Yeah. Well, we certainly thank you for coming today, and we learned a lot and shared a lot, and we would love for you to come back again.
Yes.
And thank you so much. And our next month we'll look forward to, and since February is the month of love, we're going to do some things on self-compassion. And see you next month.
2022 to me means hope, growth for myself and my professional and my personal life, as well as building better relationships outside of work and inside as well.
Thankful for today.
I'm grateful for every year that I get, and 2022 is no different. It means a chance to show my gratitude for the people in my life and for what I already do have. But it's also an opportunity to grow personally and professionally and to just start fresh.
2022 means to me growth and happiness.